Hi everyone, this is Rick Steitner at Coastal Hearing Center in Pawleys Island. I'm the audiologist here, and we're at 245 Business Center Drive in Pawleys Island. You know, our topic today is going to be real simple. Last week we were talking about the audiogram and hearing loss, and now that we have kind of gone through that, our next step is when you get your hearing test and you find out you have a hearing loss, what's the next step? What do you do? Well, if you remember, we talked about a couple types of hearing loss. One was a conductive, and that's common more often with children, where there might be some fluid in their middle ear. And that type of hearing loss needs medical attention. So we would refer that parent and that child back to their pediatrician for some medical intervention. There are other types of hearing losses that require medical attention. And that's always important when we find that type of loss to send it over, that patient back to their physician and or pediatrician. The other type of hearing loss is a permanent one, and that's what we call a nerve loss or sensory neural. And a nerve loss is really not anything medically that can be done. And so really the option for somebody that has a nerve loss, which is the most common type of hearing loss, is to have some sort of remediation. And that remediation for us is providing hearing aids and providing hearing aid technology. There are several types of hearing aids. Behind the ear hearing aids, you've probably seen many people in your neighborhood that have something like that, or an all in the ear hearing aid. You'll find less and less people with the all in the ear hearing aid. It requires a particular type of hearing loss. But again, it's pretty simple. When you find out you have a hearing loss, there are things that need to be done. So many patients at first are hesitant, and what we always tell patients is, come on in, we'll actually give you a pair of hearing aids if your hearing loss is the kind that needs hearing aids, and we'll give them to you for a week, let you try them out. We don't want people just getting hearing aids for the sake of getting hearing aids. We want patients to see the benefit, to really experience what it's like to be able to hear with hearing aids. It has been phenomenal in the last several years, the technology changes that have occurred in hearing aids. And I've been doing this for 40 years, and I've seen a lot of types of hearing aids. The responses that I get back from patients today is excellent. They find that they're hearing clearer, not just louder, but clearer. Because the biggest complaint everybody has is, I know somebody's talking to me, but I'm not quite sure what they're saying. And I know you can relate to that if you, in fact, have difficulties hearing sometimes. So really the most practical thing to do is, once we identify that you have a hearing loss and it's not medical intervention can help, is to try some hearing aids. And we can walk you through that process. It actually is a lot of fun. We enjoy it, and we always recommend that you bring a family member. So give us a call at 843-979-3888. And we could show you the types of hearing aids, really the behind the ear, the in the ear, and actually program on a computer to let you listen to it. I think that's the best way to do it. So again, thanks for listening in. We don't like to belabor the point too much. Give us a call at 843-979-3888. Schedule an appointment. Be glad to see you, talk to you. If you have a hearing test, we can take a look at that too and give you some ideas on what we think might be the best route to take. Have a good day. Talk to you next week. Bye-bye now.